But yeah, as we wait for the others to join us in the next few minutes, I'll just go ahead and share the agenda, and I believe my screen is really visible to everyone. And as you can see, today's AGM is quite unique in that we have two main sections. We have the first part, and then we have the second part, which will consist of the AGM. And thank you all for creating time as we wait for the others to join. This is how the whole agenda will go. And then for the closing prayer, we would expect a Muslim or anyone of Islamic faith to take us through that. But in the meantime, what we have displayed on the screen will be our tentative agenda for this particular meeting. And I believe no one has any particular amendment or changes that they would have loved to make to this particular agenda. So the first part will have the WHO specs 2030, and then the second part will consist of the AGM, the updates for the academy this particular year, which will be taking place in Indianapolis. And we shall wrap it up with closing remarks from Dr. Levy. So that is the brief structure of what we shall be using in this particular AGM. But before we go any further, I think it's time. The rest will join us. The numbers are still skyrocketing, but yeah, thank you so much once again for creating time for this particular AGM. So without wasting any more time, I can see we have a lot of people in attendance. I see Professor Covin is on board, Dr. Levy, all the EXCO from the African chapter of the American Academy is on board. And yeah, without wasting any more time, I would like to request Optom Carol to take us through the opening prayer, and then we shall officially start this session. But thank you so much. So over to you, Optom Carol.
Thank you, Wanok. We can all bow. Heavenly Father, we come before you with gratitude and strength as we gather for this annual AGM. We ask for your wisdom, guidance, and clarity in our discussion and the decisions that we'll come up with. Help us to work together in integrity and unity, and then ultimately guide us through our discussion and make a fruitful engagement for everyone in the best interest of all that in mind. May your peace be with us through this meeting, and may we all leave this session with renewed purpose and direction. I thank you. Amen and amen.
Amen. So thank you so much for taking us through the opening prayer, and that officially means we are ready to start off our session today. Thank you all. We know it's really a significant time difference no matter where we all coming from. But from this side would say good evening, it's a good morning somewhere, good afternoon, and everything in between. We appreciate all the sacrifice that you've put in to make sure that you attend this particular session. So thank you so much, and you're all most welcome. So the brief rules before we go into the exact details of this particular session is, as you join the sessions, just make sure that your microphones are on mute, unless if you really have to contribute. We are welcome to turn on your videos for as long as you're comfortable. But at any one point, if you realize that maybe there's a video that has been turned on by mistake or unintentionally, then the hosts will be forced to turn it off. But you're all welcome to turn on your videos. It puts in a much more lively interaction and reduces the effect of the barrier caused by these online communications and most of these virtual meetings. So we shall be using the chat. In case you have any questions, feel free to pop them in the chat. If you have any clarification or doubts as the speakers are presenting, please just feel free to pop them in the chat, and feel free to use all the reactions. And in this particular meeting, we shall give each and everyone equal opportunity to participate. So you're all welcome to bring in your A games for this particular session. And once again, thank you so much for creating time for this meeting. So I'll take what I've just said for the last few seconds as our opening remarks, and all the other delegates and everyone will be able to present as the session goes forward. So as we've all seen what we have on the agenda, we already know that the first aspect will be looking at the WHO specs 2030, and we shall be discussing a lot of things. And to delve so much into this and give us all the details that we need to know about the WHO specs 2030, we have Professor Covin. Professor Covin will be doing a double act with Professor Tuwani, but yeah, Professor Covin will go in first. Over to you, Professor Covin.
So thank you, everyone. Tuani and I had a discussion around this thing. She's doing the main act. She's going to do the PowerPoint presentation. And then I will come in and then talk about how we should respond as a profession to this challenge of WHO specs. But she will give the main meat about the program itself. Tuani?
Thank you. Am I able to share?
Yes, you should be able to.
Okay. Good day, everyone. As Colvin has said, I'll be sharing on WHO Specs 2030. We'll just give a brief background on Specs 2030. We all know that after the World Vision report was published, then we had the World Health Assembly that came up with Resolution 73.4, where the members urge the Director General of World Health Organization to provide technical support to member states to implement the integrated people-centered eye care as part of the support to achieve universal health coverage. And then later on, in 2021, the World Health Assembly then they came up with the global targets for the integrated people-centered eye care, and which those global targets were to increase the coverage of cataract surgery by 30% by 2030, and also to increase refractive error coverage by 40% in the year 2030. So let's just look at the overview of WHO Specs 2030 and also the Global Specs Network. After that, what happened is that World Health Organization came up with the Specs 2030 initiative, where its vision is to envision a world in which everyone who needs spectacles. So this was only, we just looked at refractive error, where the vision is for everyone who needs spectacles has got access to quality, affordable, and people-centered refractive services. And the mission mostly is to support the achievement of those 2030 targets on effective refractive error coverage. That's how we came up with SPECS, which is SPECS, and which Prof. Colvin has been was also part of the first group that came up with the strategic and also the outcomes. So there are 5 strategic pillars. The first S that stands for improved access to refractive services. And then the P stands for building the capacity of personnel to provide refractive services. And the E is to improve the population education. And that E is very important because if ever the people are not aware of refractive error, then we will not going to achieve the targets that have been endorsed by World Health Assembly. Then the C is stand for to reduce the cost of refractive services. And the last S is to strengthen surveillance and research. So we need, in order for us to see that whatever we are doing is effective, we need to come up with surveillance and also research. So research plays a very important role. This is the desired outcomes. I'm not going to go on that because it has so many things. So with Aspects 2030, we started with advocacy, where we have the WHO Global Specs Network, which is a network of stakeholders with a common vision to promote a collective and coordinated advocacy. And another branch of the WHO initiative is also to come up with the specs normative work. So that includes that will include experts that will provide technical input to the World Health Organization to develop the technical guidance. And also it has the private sector dialogue. And out of those, I think the private sector dialogue is starting now. The other two, the normative work, they have started already, and also the network, it has already started. It's also very important to have that private sector dialogue because it's promoting effective and meaningful contribution to increasing the coverage of refractive error services. So I'll talk about the network, which is what the work that is being done now. Mostly the network is the informal network for stakeholders to promote advocacy and action towards the achievement of that 2030 global target for refractive error. And they share experience and they expand their professional network. And it's mostly administered and housed in the World Health Organization. So the objective of the network is to unify all stakeholders under a common vision of action that is needed to achieve the 2030 global target for refractive error, which will include to create a common understanding and also a narrative of the evidence-based policy change that is required to increase the spectacle coverage. Then another objective is to conduct evidence-based advocacy activities that will increase support for World Health Organization public health objective and raise awareness on refractive error. Then the last and not the least is the objective is to strengthen the discussion and exchange of views and knowledge sharing. So this is what is being done currently. So we do have the WHO Secretariat, and then we have the foundation. We have the foundation committee, and then this is the network. And we have three work streams. One is to deal with the service delivery, integration, and product supply chain. That is we're looking at advocacy now. And then also advocating for workforce. That is the second work stream. And the third work stream is for awareness and demand generation. So those are the three work streams that are there. So the members, we have the first group of call for members. So we have members, those are the network. And those members mostly, those are intergovernmental organization, non-governmental organization, academic institution, private sector, and also philanthropic foundations. Okay, so this is the governance and also the structure. Okay, so the activities that have been achieved so far, we have looked at the vision, mission, and objective for the 3 work streams, and also look at the key messages and the work plans for each work stream. And then the launch was done in Geneva in May 2024. Then in June to July 2024, we did the refinement of the work plans. And currently all those activities for the 3 work streams have started. So what is the next step? Currently, we have the second round of application for membership. So this is open. This is open to, it's not for individuals, it's for association, it's for organization. And then from September 2024 to June 2026, the activities continue according to those work plans that have been there. And also now we are doing the introductory workshop in different countries about SPECS 2030, what it's all about. And in those workshops, the introductory workshops, we are also including the Ministry of Health, the country World Health Organization people, and also for each country, the NGOs, the universities, the associations that are mostly those are optometry associations that we would like them to be part of. And then we'll have also continue with monitoring and evaluation, which is based on indicators, timeframes, among others. So for people, you can go on the World Health Organization to look at some of the resources that are available. So we have the TARES, TARES, we stand for Tools for the Assessment of Refractive Error Services, that is available online. We have the ECSAT, which is the eye care situational analysis tool. That tool is supposed to be completed by each country, the Ministry of Health, and sent to WHO. And we haven't got the eye care situational analysis tool results being completed mostly from Africa. So it's very important that we have to look at. So that tool, it has things like on it, it has how many cataracts, how many refractive error, how many, the equipment that is required. So the minimum required equipment that is required for refractive error, for optometry, and also for, say, for cataract or for ophthalmology. And then we also have the ECCF, which is the eye care competency framework. And then we are also currently working on the competency, which is CRET, which stands for Competency-Based Refractive Error Teams. That is the competency for the refractive error teams. So to end on this, there's the call for action. As I've said, there is the call for association or organization who are interested to apply to be members of SPECS 2030. That call is is open now until December. And also there's call for organization or association to host an introductory SPECS 2030 workshop. So that workshop, as I said, it will include the Ministry of Health as part of advocacy and also after that, and also the NGOs. And after that introductory SPECS 2030 workshop, we would like those associations and organizations to assist in making sure that each country, they feel the eye care situational analysis tool. And also, if ever the country doesn't have a eye strategy or national plan on the national plans on that include also vision, eye health and vision, then we need to advocate for those for vision or for refractive error. In this case, it will be refractive error to be included in those national plans, health plans. I'm done with the introduction. Thank you.
Thanks, Tuani. That was actually the main part of it. I had not an introduction. You did a fantastic overview. So my role is to reflect on what does it mean for optometry. Okay, I'm going to be brief. We would like some questions and some comments. Now, many of you may have heard about Vision 2020. When I first got involved in blindness prevention work as a new public health graduate, it was starting around that time. And the reality is that optometry's role in Vision 2020 was very minimal. But many other sectors, both other professions as well as NGOs, etc., saw the opportunity to effectively use Vision 2020. However, this time we have WHO specs, and WHO specs is core to the business of optometry. But again, the reality is that we will find that once WHO makes something a eye profile, lots of people get involved in it, non-profits, other organizations, etc., because funders respond to these particular campaigns like WHO specs, okay? And there is a worrying trend emerging right now. There's this huge talk about, in the context of WHO specs, about presbyopia, because it's a huge problem, as you know. And of the almost 950 billion people that are affected by presbyopia and uncorrected refractive error, only about 150 million are refractive error as we understand it, the rest is presbyopia. And the problem is that much of this is about doing anything to get reading glasses to people. And I've sat in meetings, and Tuani will probably tell you now, that where funders get excited because they don't understand eye care. And all they understand is that people will go back to them and say, we've distributed 1 million spectacles, and if we can do that for you, and then we are sorting out this problem. As optometrists, we know that's not the reality. The reality is that we need a systems approach. We need to make sure that we screen, address, find people who have presbyopia, refer for full refraction, etc. If not, all of these become what we call hit and run efforts that collapse, okay? Now, we need leadership around this. And we have to, the area that we are most vulnerable is optometrists are not where we need them to be, right? And the reality is we're never going to be there overnight. However, we are fortunate now that telerefraction has become an alternative. Telemedicine has become an alternative, okay? If we take Africa, for example, we've got Ethiopian, Zambian, quite a few of the Kenyan quite a few of the optometry associations have partnered, for example, with one side, including the Nigerians, with one side SLO Luxottica Foundation to expand their services through telerefraction. It needs that visionary leadership, because with WHO pushing and the profile, if we don't respond, somebody else is going to do our job. And I can tell you that optometrists are going to be left by the wayside on this thing. And it's a critical thing that we must not take WHO specs lightly. Right now, the profession is there by WCO. I'm not sure how much WCO communicates with its members around this, how much it is pushing around these things. I don't get a sense that there's a big movement around it happening. But I think this is very critical, especially to us in Africa, because everybody wants to do everything in Africa, as you know. Okay. And we need to look at how we can be there as a profession. One of the other issues is we got to make sure that every one of these workshops that take place, we are there as a profession. And when I say we, it's not Coven the optometrist or Tuani the optometrist. It has to be the National Optometry Association has to be physically present. You need to be engaging the National Eye Care Coordinator. Say, we've heard about WHO specs. Is there anything we can do to help? If you need information, blah, blah, blah. Because the reality is, if you're not there, these things are going to happen without you. And once it happens, governments listen to the WHO first. They don't listen to you or me first. Okay? So we need to be very, very clear about this, how we approach this. Awareness is an area we can address. Our national association have to get involved much more in health promotion and awareness. And we need to push them to do this. If we don't, the reality again is others are going to do this. And these are attractive areas for people to raise funds off. So they will push for these things. Okay. So we need to respond very aggressively. And the last thing I want to comment on is the cost issue. I know that most of us are resistant to lowering costs. We say, if I lower it, how is my practice going to survive? It doesn't have to happen within the context of your practice. It can happen in other contexts. It can happen even within the context of your practice. But nothing stops us from looking at rural programs and outreach programs that can meet those needs. For example, we launched with Berkeley the One School at a Time campaign. And in Africa now, we've reached more than 100,000 children, where we are providing free services for children. Okay, these are kind of things we need to start looking at. And reason we call it One School at a Time, we're asking optometrists to adopt a single school and provide a service. If we don't raise to this, I can guarantee you that people are going to be recommending alternative human resource strategies, which means alternative to optometrists. They're going to be we won't be at the table on a lot of this, and it's not going to be in our interest. So I'm going to stop there and leave some time if people have questions or comments. I know I may not have painted a very rosy picture, but I think it's important for us as optometrists to be really frank about what the challenge that we are facing right now really is. Thank you.
Thank you so much. Thank you so much, Professor Colvin and Professor Tuani, for giving us that great overview on what Specs 2030 is. And we've all heard it that if we don't really rise up, then someone else is going to do our job. And that is like the last thing that I believe anyone on this platform would really like to happen. So we have our chat right open, but before we go into the chat, we shall use about 10 minutes to just discuss this. And if you have any questions, please just feel free to raise your hands, just like already Dr. Stephen Okansei has done. So I'll hand over to Dr. Stephen right away.
Hi, thank you very much, Prof. Tuani and Govin for the presentation. I didn't hear much about funding, so I wanted to ask for more clarification. If, for instance, the WHO has plans to make funding available for the SPECS program, particularly to support the implementation and the sustainability of the initiative, especially in low resource countries like Africa.
So I'll start and maybe Tuani can add, but WHO's priority is to get funding to run the program, to create the WHO specs and do all of that. There are people that are employed, it takes a lot, they need consultants. But WHO does not support national level funding, right? Unless a big donor comes and says, we'd like to support Zambia on a program, and then, through the WHO. So really, this is about creating a program to push governments to invest in the funding. And they won't be like, and remember, WHO programs are through government. It's not through others. So all that funding will go through government. It's not like you if you set up an NGO, you're going to get funding. In fact, in many cases, the WHO depends on the NGOs to fund it and support national government. So that's why advocacy is such a big point. And in Tuani's presentation, you would have heard that she raised advocacy many times. It's about pushing our governments to prioritize WHO refractive services. Okay. Now, why is it easier now? In the past, everybody only spoke about cataract surgical rate. That was the key indicator. Now they're talking about effective refractive error coverage, right? And why effective? It is not only about who gets glasses and eye exams and glasses, but who can see after that, because there are a lot of shitty refractions being done across the world by people who don't know anything about refractions. Sorry for the term, but I think it gets the message across. So I think that, and I'm part of the group that's publishing a paper on the latest data around the effective refractive error coverage. And that paper will come out soon, but there's been already a paper, and the numbers are very bad at the moment. So we got to make sure that we engage in advocacy to get government to invest in refractive services. And if we are in country, we must push the local NGOs to align their strategy to WHO specs, or the international NGOs to align their strategy to WHO specs.
Thank you so
Yes.
much for that comprehensive response. Yes, over to Professor Tuani.
Yes, the WHO actually is looking for funding. It's not funding organizations, but the member on the net. That's why now we get some of the big companies coming in, and most of them, they want to do the funding. And that's why, however, that funding, we are saying that funding has to go through the government. However, when it goes through the government, we as optometrists, where will we be? We need to be at the table, not to be an afterthought. So there's also another part of Specs 2030, which is research, that we need to look at the grants in order to fund those kind of research. And I'll give an example. There's actually one big NGO called wrote the other day to us and said that, when I say us, it's the foundation committee, and said that they want to launch Specs 2030 in one African country. Okay, I will name it Malawi. Okay. And we look at who will be the audience who will be invited. There was no optometrist. And we know that in Malawi, there's national optometrist. It was the what do you call it? Community healthcare workers. Because for them, they just want to bring reading glasses. And I don't know how those reading glasses will be distributed if ever there's no examination. So, which is why it's very important that we also look at the competences for the refractive error teams. And even though we are looking at refractive error team, we are saying that optometrists, and in some countries, ophthalmologists, they are doing refractive error. And on top of that, with the refractive error, they do the whole eye examination. Thank you.
Thank you so much for the comprehensive response here. Any questions, please? We still have about 2 minutes. If you feel like you have any questions or any clarifications along the lines of Specs 2030, this is the opportunity. And we're lucky that we got first-hand information straight from Professor Tuani and Professor Colvin. So if you feel like there's anything, please this is the time to just let us know. Or if you have any doubts, just come out and it will be clarified since the presenters are both still here. And one of the things that we really have to take note of is that all these resources are actually available online, as it was mentioned. And Professor Tuani said we could actually check out on the WHO website for all the other resources and anything along those lines. And the other important thing for us to note is that this is not an individual initiative, and that also still goes towards the whole idea of working together as a team. So we always have to make sure that if at this point you don't have a strong country association, it's time to make sure that everything is together to just make sure that you work towards this particular goal. So we still have about 60 seconds. If you feel like you want to say something about it, please just feel free to unmute or use the chat to just let us know. But thank you so much, Professor Kovin again, and Professor
Can
Tuwani.
I just make one point before we end? I just want to caution as Africans that we should not get sucked into global strategies that may say that this is what WHO specs will do. Because what may work in Europe and what may work in the US will not compromise optometry, okay? But in Africa, if we are not innovative, don't look at how we can work with others, how we can create access, use technology, all of that, we will get left by the side, right? And we got to be very, very careful, because I often hear people say, oh, but we in optometry don't support this. But what they're talking about is a developed world perspective, right? And in the developing world, where most of the money is going into, and in Africa in particular, by the NGOs, etc., if we don't show leadership, we will get left behind as a profession.
Thank you so much for that. And I'll take that as a concluding remarks from Professor Kovin. So because Professor Kovin gave us the concluding remarks, I'll also go back to the main act, that is Professor Tuwani, your parting shot for the attendees in this particular meeting as far as SPEC 2030 is concerned. Professor Tuwani, just your concluding remarks for the members. Thank you.
I think that this is a good platform for optometry to shine, and most of the work and most of the NGOs or the funders, they want to, NGOs, they get their funds and they use us, Africa, that we are the low middle income countries. We have low, we have so many low income countries, and also our governments cannot do anything about it. So I think it's very important that if ever there's no association, wherever you are, we need to get a very strong association. And all of us here, we need, this AFCO, we need to make sure that AFCO become the real AFCO. Our association really know what it is all about, especially with the SPECS 2030 and other organizations, so that we know how to, promote, because SPECS 2030 is based on integrated, people-centered eye care. And also, as I said before, this is to support universal eye care coverage. Thank you.
Thank you so much. And this all goes back to what our seniors have always worked towards in the last few years. You can all remember that the whole story of, if we don't come and take part in this, then usually someone else will end up writing the stories that they'll assume will be reflecting of us, which is not really the thing that we would all really want to do. So let's use the links that have been shared in the chat to access all this information, and then let's all get involved in all our capacities as a team and as the country associations. Thank you so much once again, Professor Kovin and Professor Tuwani, for taking us through the first part of this particular meeting. Thank you so much. So we're now going to move on to the next aspect of this particular meeting, and that would be our AGM. And yeah, that would be the most important thing at the end, and we shall discuss everything else towards the end. But before going into all those other details, we're going to start with the reports. And I would like to take this opportunity we shall start with the Secretary's report, the Treasurer's report, and then later on, we shall have a report from the student representative, and that is from the African Federation of the Optometry Students. So we have very few minutes, but I'll give this opportunity to the Secretary of the African chapter of the American Academy of Optometry to share the report. The floor is yours, Dr. Mariette.
It's me.
No, it's
Okay, all right,
Tawani. Why not? It's
okay,
not
great.
me.
Yeah, okay. All right, thank you. Yeah, sorry about that. Yes. How about you again, Professor Tuwani, in this time round as the
Okay.
secretary of the association?
Okay. It's the interim. I think that's what we can say. Okay. Since the meeting that we have on the World Optometry Day, there have been so many things that have happened. And firstly, I just want to say that we are proud that among ourselves, we have Prof. Okensi, who have, and together with the staff at the University of Cape Coast, they have started it's the first time that we are going to have the faculty, okay, or the School of Optometry and Vision Sciences. And Prof. Okensi is the founding dean. So we need to appreciate him. And I think that that is the step in the right direction. So we are going to learn from the University of Cape Coast so that we can move in other countries. And this other one is that one of our own has been nominated as the Dr. Maureen, not nominated, has been elected as the, is it the commissioner in one state in Nigeria? And we want to acknowledge her for that. I couldn't get the surname right. For Dr. Maureen. Okwa, yes.
Ahokwa.
Oh, thank you. I've written a wrong surname. Okay, so since that we have that meeting in May, as I said, in March this year, there are also some developments in terms of, one, we listened to most of the breakout sessions that we have. We had 3 breakout sessions. The first one was how to improve the effectiveness of our mentorship program with the African chapter of the American Academy of Optometry. And we have started with most of them. We based most of our webinars based on the feedback that we got from those breakout sessions. So I want to thank everybody who attended and also everybody who presented on the different workshops. And the other thing, which there are still some things that we haven't achieved, but which we are working towards them. The grassroots mobilization was one of the things to how do we enhance the engagement and participation, particularly among young members and those from under represented backgrounds. So we said there must be grassroots mobilization where we have to have one-on-one with the younger ones. However, I'm happy to report that out of the breakout, we have started with the regional student chapters, which is I think that was, and it has started in a very, I mean, it just blew my mind because they are very, very active. So which means that if ever we can get the students to be involved, they will be able to run through, and then we will increase and foster excellency in optometry. So remember, one of our objectives is to keep abreast with the scientific and also the clinical developments, and also to recruit all optometrists for them to be eligible for membership in the American Academy of Optometry. And also to create a platform for research collaboration. So which is one thing that we are still going to work on, which is the research collaboration, and also in terms of institutions to have project supervision among optometrists, researchers, and also the optometry institution. And the other thing is for us to be able to bridge the gap between the African optometrist and the American the other optometrists from the other regions, especially when we are looking at the American optometrists. So that is my brief. The mentorship program is going as we have indicated, is going fine. And then now I would like to ask the student representative as part of, of this report to just give us a 2 minutes report on what they have been doing so that people can know what the student chapter has been doing. Thank you.
Thank you so much, Professor Tuwani, for that. Initially, we were supposed to have the treasurer's report, but because the student's report is part of the secretary's report, I would like to take this opportunity to invite the representatives from the African Federation of Optometry Students to take on the lead. I think we have Pemija on board. Pemija, if you're available, I don't know if you're the one representing, but if you're available, please, yeah, let's take it on from here.
Okay. Hello, everyone. Good day. I'll be the one to represent IFOS in this
Great. Thank you
meeting.
so much. Yeah, thank you so much. Please
Thank
just go
you,
ahead and
okay.
introduce yourself, the role in EFOS, and then take it on from there.
Thank you very much. Hello, everyone. Good day. Please, my name is Nathaniel Amuaben. I serve IFOS as the Vice President, and I will be giving the reports on behalf of the whole Federation body. So IFOS, as we know it, is the African Federation of Optometry Students, and it was founded in March 2024, led by Dr. Levi, with the aim of empowering optometry students across Africa to become leaders, to develop their leadership skills, become entrepreneurs and professional skills, crucial to the success in evolving the field of optometry. So in recent times, in recent months, we have been able to achieve several milestones. Among them is we've established partnerships with Bosch, APCO, Africademics, and then the Canadian Vision Care to support student engagement and service outreaches. And then we have been able to establish 2 new Bosch chapters in 2 African countries. And then we have had the opportunity to also attend the South African Optometry Association general meeting, Nigerian Optometry Association general meeting. I mean the optometry general meeting. And then we're also available during the African Council Optometry meeting at Uganda. To also have our presence felt there also. We have got the opportunity to partner with academics to provide scholarship opportunities for AFOS members to pursue their master's education, their postgraduate education after their degree, optometry degree. We have met with the board members also of the American Academy of Optometry to inform the students of the pathways to become a member or a fellow with the American Academy of Optometry. And then at the moment, there are plans in place to also meet with other international bodies, including the World Council of Optometry, and then to also introduce ourselves to them. Just recently, we met with IAPB to also have introduction to them, and then also for them to also talk to us about preventing blindness, which was in line with the recent World Sight Day celebration. And we have brought together a team of experts in career choices to inform the students on opportunities that exist in the optometry globally. So that is it for AFOS. Additionally, we seek to become affiliate members of certain key organizations, like I said, as AFCO, Bosch International, Global Optometry Public Health Alliance, Center for Eye Care and Public Health Intervention Initiative, and the World Council of Optometry, as well as International Agency for the Prevention of Blindness. So we believe that by affiliating with this organization, we aim to further our impact, strengthen the student engagement, and foster collaborations that would benefit optometry across the globe. Currently, we have 24 schools across Africa currently on the leadership platforms from the stretch of the north of Africa all the way to the south of Africa. And we are believing that we would get to where AFOS is supposed to get to. So thank you again very much. I really appreciate the opportunity to serve and then also be a part of this. And thank you to all the leaders who put in this initiative to bring on board the student body. We really appreciate it. Thank you once again.
Thank you so much, Nathaniel, for that comprehensive report. Back to you, Professor Tuwani.
Yes, that's why I said what they are doing is mind-blowing. So it is important that we support them as candidates and as ODs, as fellows of the American Academy of Optometry. And I want to also acknowledge those who have who sponsored the students to go and attend the AFCO and the OAU conference in Uganda. So this is how we can support them. So by supporting the students, we are building the future of optometry. And the same students are going to go out to their different countries and make sure that they do have the national plans, that optometry or eye care is included or is integrated in the national plans, national health plans of each country. And for me, that's the indirect way of bringing people to be very active and then to also advance optometry in Africa. Thank you. I think I'll yield my time to the treasurer.
Thank you so much for that. And congratulations are in order to Professor Okanse and Dr. Maureen for the achievements that you've done, and we look very much forward to continuing to celebrate these achievements in very many years to come. And congratulations to AFOS as well. Thank you so much for the great presentation. I'm one of those people who are really blown by the commitment and the dedication that at least AFOS is doing on all the other social media platforms. So thank you so much for that. Without wasting any more time, let's proceed to the Treasurer's report. Yes, Professor Bernardine.
Okay. Hi, everyone. Thank you, Wanak, for the great work you're doing. Yeah, I'm here to present the Treasurer's report. There's not a lot going on in that sphere for now. And like we all know, there are no dues being paid as member of the African chapter. According to our bylaw, it's up to us to decide if we need to continue that way or we need to find a way around that to see if we need to start paying dues or not. So most of our activities are based on support. Last year, we got support from EGA and Esilo Exotica for our African party. This year, we were actually already planning to see how we're going to source for funding for the party. And luckily, we got a mail from the AAO saying that there's going to be a general international party, so that way we're not going to have our usual African party like we had last year. So we stepped down on that because we were already preparing, estimate on how we're going to fund that activity. So, and that didn't happen anymore. That's not going to happen anymore. So also, we are also thinking about ways of, raising funds for some activities. Currently, we're thinking about having pins and mufflers for the chapter, and some members have volunteered, had donated to that effect. So we're wondering also, if the president will talk more on that, if members will be willing to drop some token, to have that during the Indianapolis conference. So we feel that's also one way of trying to raise funds for the academy. So I think that's just in brief what the Treasurer's report is about. There's not so much going on in that space. Thank you all very much for your time.
Thank you so much for the report. It's well received. And yeah, with some of the conversations will be taken over again by the president later on, or the chairperson later on in his speech. But yeah, so some of you might be wondering why we only have 2 or 3 people talking. Now, this is an opportunity for everyone else who's on board to actually be part of this particular meeting. And now we're going to move onto the breakout rooms. And just like we did in the last AGM, this is just an opportunity for us to get insights on what is working, what is not working well, because we believe that at the end of the day, it's your opinion that matters, and that will be the great opinions that would lead to the development of this African chapter and the profession at large. So we're going to proceed into the breakout rooms. And the topic for discussion for the first breakout room session will be what has the African chapter accomplished this year that has positively impacted your practice or the community optometry. We shall post some of them as well in the chats later, and we're going to have, since we have over 44 members in attendance, we're going to have about 3 breakout rooms, which will have approximately 14 people per room. And in those breakout rooms, we request you to choose to nominate who the chairperson would be and then the secretary. And we're going to have these breakout rooms last for only 15 minutes because of time. And then we shall later on converge to discuss the details and feedback on that. So that's the first breakout session. We have 2 breakout sessions. The second one will be a follow-up from this particular one, and you'll also find it easy. But the bottom line is this is an opportunity for each and everyone to have their voices heard in this particular AGM. So we're going to break into the breakout. We're going to break into the breakout rooms in the next few seconds, and you'll be in one of the 3 breakout rooms. And the breakout rooms would actually last for, you'll have a countdown of about at exactly 60 seconds to the end, but it should last for only 15 minutes. I don't know if anyone has any question, any doubt. I'll just go silent for only 5, 6, 7 seconds before we break into the rooms, just in case anything is not clear, just in case I stumbled or didn't say anything as clear as you would have expected it to be. Okay, that silence would mean everything is okay. So we shall all go into the breakout rooms right now, and we shall be back in 15 minutes. Much for that. Yeah, each group had about between
One of your time
12
was
and
to
yes.
show us. We
Yeah,
were
I
still
sneaked in.
on and
Yeah,
it just came here.
yeah.
And
No, yeah, no, but yeah, well done. I sneaked into all the rooms, and I was actually happy with the level of engagement that was taking place in all the
yeah,
rooms. So yeah, thank you so much for that. Yeah. And yeah, let's see how it goes. But yeah, thank you so much for that. We excited to hear the feedback from the sessions. And remember, the question was, what has the African chapter accomplished this year that has positively impacted your practice or the optometry community? So that is what we want to hear. I'm sure the groups have selected who their speaker would be. We shall just use about 2 to 3 minutes per group till like half, yeah, in the next 8 minutes. We want to just hear feedback from every group member, from every group. So we shall start with group 1. Any member from group 1 who was willing to represent the group or who was assigned and given the right,
Yeah,
yes.
good
Yes, go
evening,
ahead.
everyone. I'm
Good evening.
Gloria. I'm reporting from breakout room 1. Yeah, we checked the question. No, the question was, what has the chapter of the American Academy done well that has impacted your practice, your conduct as an optometrist? So in discussing, one thing that was common amongst all the discussants was the selfless dedication of the leadership of the American Academy. That the selfless dedication has been a great motivation for all of us, to be able to become more, that has challenged optometrists to be more global oriented in their conduct. It has been inspiring to enable people achieve their dreams of becoming a fellow. And in addition to that, one of the things that we have gained from the leadership of the American Academy is this bringing in the conduct of excellence in all that we do, seeing the fellowship, beyond just getting the fellowship stuff, but to give more value to the standards of practice. In addition to the motivation and inspiration from leadership, we have been able to build significant networks that has enhanced, that has given us increased opportunities to share ideas with colleagues around the globe, which has greatly improved clinical experience and performance. And then another thing that we have gotten, another benefit, is the fact that we now have a collective movement of African optometrists working hard to elevate the profession to influence eye care in Africa to global standards. So this is just a summary of the discussion from breakout room 1.
Thank you so much, Dr. Gloria, for giving us the details from group 1 here. Thank you so much. And we're going to hear from group 2 now. Any representative from group 2?
All right. My name is Dr. Frank Aworum. I'm representing Group 2. Yeah, I think.
Yes, Dr.
Okay,
Franca,
so
yeah,
the
we can hear you
summary.
loud and clearly. Yeah.
Yeah, all right. So summarizing what we discussed, we said some of the benefits that we derive from the African chapter is that one, it has created awareness for African optometrists to go beyond their local chapters and see what they can do globally, how they can join the global community of optometrists and see how it has really been benefiting every one of us individually and collectively. By the time we get to Indianapolis this November, we'll find that there are more African optometrists, especially Nigerians. I'm talking from the Nigerian experience because I practice in Nigeria. So a lot of Nigerians are keen in, and then joining the academy to benefit a lot of things that come from becoming fellows of the American Academy. Then we also talked about representation in academy leadership. People are being nominated, African optometrists are being nominated into positions, sensitive and beneficial positions. So the more Africans we have in leadership of the academy, the more beneficial it will be for us. Like Dr. Obiwanne, who is he has a leadership position, yes, in admittance, I think. Then we also have that we have participation in research at different levels. So African optometrists are now participating in research, different aspects of optometry, which is very good and helpful to all of us. And then again, African optometrists are being guided to become fellows of the academy. It's making it easier. The different mentorship sessions that we have are guiding optometrists to become fellows. It's making it a lot easier than it used to be in the past. So this is a summary of the things that we discussed. Thank you.
Thank you so much, Dr. Franca, for giving us that report as well. I won't react much to it, but yeah, thank you so much. Yeah, I really appreciate it. And then last but not least, the group number 3.
Well, can I share my screen because I typed
Yes,
whatever
please.
they were
Yes,
saying?
please. Yeah. No worries.
Okay.
It's okay. That's fine. You can, yeah. Right.
I don't know if you can see this.
Not yet.
Am I doing it right? Because Bernadine can report. Wait. Share. Let's see. Can you see it now?
No, it's not yet visible. So maybe you're sharing a different screen. Yeah, it's now coming. Yeah.
Okay.
Great. We can now see it. Yeah. Great. Thank you.
All right. So
Yeah.
Bernadine can go ahead.
Marie, go ahead. And
No, I know. Okay. Okay, so it was just it was reported that the chapter, the opportunity that was given, and I think the main thing is that people are more research minded in the practice, and they're looking when they're doing their examinations, they're looking at things more in depth. And I think this comes with writing up the cases. So it's not just doing a normal visual examination. They're looking at it from a different angle now when they have to write up their cases. And it's not just a normal thing. They're investigating it much more deeply and with a background of having to substantiate what they are doing and why they are doing certain things. And from many of the others, the mentorship program has been highlighted. I know it's not the mainly the main question, but the mentorship program has been highlighted and how the mentor-mentee program has benefited many of the optometrists. And Dr. Awal reported in terms of also that the networking was beneficial to him based on the platform. And I think also it was said, practice what you preach. It comes back to the fact that the evidence-based practice, and it also was linked to the mentor-mentee program, is that when you became mentor, you also had to be on your toes and go back to how you had to look at what your mentee was doing, and you had to read up and make sure that you were advising correctly. And some were saying that obviously that were beneficial to the mentors as well. And you were gaining knowledge. And then the last one, unfortunately, one of our speakers were cut off, but it is that in terms of clinical practice, that the best practice was improved. And also that the participation in the African chapter has improved the sense of reasoning in terms of when they were seeing their patients, that no stone was left unturned. And I think this comes back to also writing up your cases, that when you're investigating or sitting with your patient now, your point of view has changed. And that is how it's impacted the practice, that your level of practice has changed for the better. So that's what I can report there.
Thank you so much. Yeah, would just request that if anyone was taking notes for every group, you can send it to the chapter's email address. Even if this meeting is recorded, we know we can always get the information that has been shared, but I feel like you've written it down nicely, like it has been done. Just forward it to the chapter's email address for the leadership team to read and consolidate and even discuss further. We won't have any reactions to that right now. Based on all the input we've all had, we've seen that here a lot has been done in the last 1 year, and a lot has been done. And that brings us, that is the main reason, actually the second and the last breakout room, which we'll now be looking at. If you're to look back onto what has been done, try to now consider what areas of improvement and new initiatives would you like to see in 2025 to enhance member engagement and advance optometry practice across Africa. So we've taken the approach of, yes, we've appreciated all the good things that have been happening, and that is great. Well done to the whole team. But is there anything that any member would like to bring on board that will form the basis for the next breakout room? And for the second breakout room, due to time, we'll only spend 10 minutes in it and then have 5 minutes for the feedback. And then later on, we'll move on to the other communications. But yeah, that is what we shall be doing. And to also give members an opportunity to interact and meet new faces, we shall reshuffle the groups again. Yeah, so that you might be, if you end up with the same members in the same group, you would be lucky, but most likely you won't be in the exact same group. So we're going to recreate the group, unless if anyone has any question again. But this time around, we're going to spend only 10 minutes in the breakout rooms. But we also hope that you really enjoyed and loved engaging with other people, and we hope that everyone managed to make their voices heard. So the second breakout rooms will be starting, and this time around it's for only 10 minutes. You'll again receive a countdown with all the details, but that is it. And I'm going to open the room in 5 seconds. Please just click on accept the rooms. And the question for discussion is just there. What areas of improvement and new initiatives would you like to see in 2025 to enhance member engagement and advance optometry practice across Africa? I'll try to type it as well in the chat. Thank you so much. So I'm going to open the rooms It's only 10 minutes. Thank you so much again. But yeah, great. Thank you so much for the active engagement in the breakout rooms. We really appreciate all the feedback and everything, the discussion, and we hope you enjoyed meeting new people and hopefully made new connections that you can keep using even to this particular AGM. So without wasting any more time, we're going to just spend a few minutes. We know we're trying to compete against time. And our question for discussion was, what areas of improvement and new initiatives would you like to see in 2025 to enhance member engagement and advance optometric practice across Africa? And if you remember the logic, we're using the thing of, we've appreciated the good things which have been done. We're discussing it in the present, and now we're trying to identify what more can be done in the next year to just make sure that we continue advancing our noble profession on the continent and beyond. So we're going to change the orders this time around. We shall start with the third breakout room. Any member to just from the breakout room number 3 to give us any feedback. Thank you.
I'm
Dr.
Dr. Obiwani.
Yeah.
Yeah, and I'll be speaking on behalf of Group 3. All right, I can see your screen, Marike. Basically, some points were re-echoed, so I'll just give a summary of what Marike has on the screen. There was a lot of inputs about mentorship. We did talk about the benefits in the initial session, and in this second section, would like to see more individuals volunteer their time to mentor candidates, so that we don't have some mentors being overwhelmed compared to others, and that improves the quality of mentorship that the candidates get. One of the candidates also, one of the members in the my committee also talked about the quality or the specialization of the mentors, because the field would be different. For example, if you had a cornea contact lens specialist mentoring you in cornea contact lens cases, the quality of output of your cases will be better. So the encouragement is to have more of the mentors with specialties volunteering to mentor prospective candidates. Another point that was raised was for those who are already fellows to be involved with the special interest groups that the academy has, whether it's the cornea, contact lens, binocular vision, low vision, be part of the special interest groups. There are a lot of programs, webinars, trainings that are ongoing even before the main academy event. So that way you can take advantage of those, teach your mentees, and get involved with other academic activities. Another thing that was talked about was giving progress reports, in the sense that in the first AGM, we had the progress reports about how it was going so far with mentors and mentees, but we don't have that now, but it's something that we'd like to see continue. I would like the training sessions that will be done for the prospective candidates to be structured, not just something that's spontaneous and random, structured in the sense that the topics are pre-organized and known already beforehand, so that individuals are prepared, and those who have maybe cases peculiar to that area can key in and attend and benefit. And lastly, maybe incorporating some of the interesting cases that have been accepted by past candidates in some of the webinars, using them as examples and also as a continuous professional development training for both fellows and prospective candidates.
Thank you so much for that, Dr. Obinwani, for that report from the third group. Thank you so much. And yeah, I think we've taken note, the leadership team has taken note, and most of the things would be worked on, and hopefully later on in the closing remarks, the president would also give his remarks based on that here. Okay, next we shall hear from the second breakout group. The second group. Any representative who's ready?
Thank you very much. So I will be speaking for Group 2. My name is Orwell Majakolam. So we seem to be on the same page regarding the points or the things we think we need to do going forward in 2025. So great. A few of us have spoken anyway. Some persons, I think, they're multitasking and we're not active. So we agree that there's need to be one-off engagement with the mentors. We need to have a more robust and rigorous mentorship program next year. So that would mean maybe we can have ample time for mentees to submit their cases early enough and get more feedback from their mentors. That way, we can be sure that we're getting more benefit from the mentorship than what we have so far. And again, we also think there's need for us to have more webinars on case writing, because we are aware that case writing is a bit more academic writing than what we know in the normal writing. So people struggle to know how to do the active academic writing. So that's way, if we're able to develop more seminars on case writing and case report writing, that can help improve the skills of aspiring fellows on case report. And so the other thing we also talked about is on plagiarism. So because a number of persons, based on our experiences, based on the feedback we've had from some persons, were caught in the web of the plagiarism issue. So that's not is not surprising anyway, because of the background and because some persons are not familiar with the plagiarism issue and the case of self-plagiarism as well. Because some persons may submit same case report thinking that is not an issue, whereas you can self-plagiarize yourself. So we think there's need for us to do a bit more on plagiarism, so that people can understand what to do and what not to do, because sometimes it can be a bit more discouraging or demoralizing when you get the report to face a panel, or the fear, the mere mentioning that you had the problem with plagiarism, that can be a bit more disturbing and can affect the psyche of those aspiring to become fellows. And lastly, we also talked about oral interviews. So we need more. Last time we only managed to have, I think the African chapter only succeeded in having one session for those preparing for oral interview. And I think we all agree that there's need to do more on oral interview, because it's one thing to pass all other aspects of the requirements for fellowship, but you need to justify that when you meet the panel for oral interview. That is something huge, and we need to get our mentees and those aspiring to become fellows to understand what is involved and get a bit more prepared. So I think that's all we all came up with. Thank you very much.
Thank you so much for that wonderful feedback here, and the plans are giving us the suggestions for the next year. And last but not least, let's proceed to the first breakout room. Any member from the first breakout room?
Hello, good evening,
Yes.
everyone. In our group, a few of us suggested these. So from Dr. Okechi, she suggested ways we can waive these financial issues, so that the African chapter of AAO can also, attend World Council of Optometry meetings. And then from Dr. Ogechi, she suggested some workshops that would train essay writing for the American Academy of Optometry Fellowship, and then also ways we can improve on our leadership pathway. And she also looked at some of the ways we can organize an African-wide residency program beyond Nigeria for collaborative publications as well. Yeah.
Thank you so much. Thank you so much, Gabriel, for that report from the first group one. Yeah, so thank you so much, everyone, for the active participation and all the wonderful feedback that you've shared with the whole group. We hope you enjoyed the process just like we did. and we believe it's always a wonderful learning experience for each and everyone taking part in these activities. So as we move towards the tail end of this AGM, we're going to now move into the brief discussions. We just have very few minutes, but it's just brief updates. And the first update we shall be having will be the Indianapolis 2024, and that update will be shared by Dr. Maretzi. And then later on, we shall have a quick poll, Dr. Levy, and then final AOB and closing prayer. So that's how short and brief the remaining part of the program is. So I'll take this opportunity to welcome back again Dr. Marietti to give us updates about Indianapolis.
Thank you, Wanak. I'm going to try to be quick and try to share the screen. Let's see if I can do this. It's not, is it open? Yeah, let's see. There we go.
You got this, it's coming. Great, yeah. Great, yeah. It's visible.
Is it visible? Right, here we go.
It's visible, yeah.
So let's just go there. I'm going to be quick. So just the first one that I want to remind everybody that there is on the Academy website, there is actually a section for the African chapter. And if you have got something that you want to share with us in terms of upcoming events or chapter news, then please forward that to us. You will see in the full newsletters coming out pretty soon. And there will be then some African chapter news that will be in the full letter. It helps us if you can forward information to us, and it will also be, I've just taken a screenshot of that, but that we can populate all the different headings in on the website. Then if you want to download, those of you who haven't done it, please download the meeting app for Indianapolis, and I searched for it actually, and I forgot that there's a full stop, so it's academy.24. Then you can download the app from the Play Store, and all the information is on there. It also lists all the free lunches and breakfast talks that's there that you can register on the app for that one. So I'm going to quickly run through this. I think Awal has spoken about the mock oral exams that we had. Unfortunately, we only had time because we were making use of volunteers of some fellows that were available. So we had one round of mock oral exams, and we had excellent feedback from the candidates that did participate. I think it helped them in a very good way, in a sense, and some have realized that they are not so much prepared that they in the way that they thought they were. So I think it is something that we can then for 2025 look at repeating. There's a WhatsApp platform that we have established for Indianapolis, and that is, we don't want to have information for everybody, not, how can I put it, that we don't bother everybody else with Indianapolis information. So we've got a separate WhatsApp platform. If you want to join it, just let us know if you are not on that platform yet. And then currently, candidates for oral interviews, there are 17 candidates that we've got, and I'm not going to now read through all of them, but we have got 17 candidates that will sit for the oral interviews in Indianapolis. I thought I've actually practiced pronouncing all of these, but I'm now not going to do that for the sake of time. So, and then just the travel grants, we have got one major travel grant that was awarded by the AAO, and then Cooper Vision International Travel Grants. There were 6 awarded for 2024, and then 1 was transferred from 2023. So I just want to report on that one. And then obviously the AAO ESLO Award for Outstanding Contribution to International Optometry, and that was awarded to Dr. Godwin Owenseri. So I think that is what I wanted to report on, and what the main thing for me is just that I will on the WhatsApp platform then share information regarding and request information regarding when people will be coming into Indy, so we can look at ride shares and information regarding the weather and everything else. And if there's questions that you want to ask, please put it on, and there's a lot of people that will be able to answer if there's questions regarding where to go, what to do. That's why we established that WhatsApp group. Thank you very much.
Thank you so much for that, and congratulations to everyone who's made it to who has made it to both the oral presentations and those who have received the travel awards and all the other achievements. So congratulations, we're so happy and we keep celebrating all of you. Then moving on, it's time for me to hand over the poll and everything to Dr. Levy to take us on to for the next few minutes. I know we're already past time, but please just bear with us for just a few more minutes. Over to you, Dr. Levy.
Yeah, thank you. Thank you, Wanok. Thank you for the wonderful organization again, as usual. And thanks everybody for attending today's AGM. It's really a proud moment for us as a chapter. And I just thought there was really, I mean, we've covered everything that we need to do, but just to let you know that we do have a questionnaire that I just posted on the chat. Just a feedback from everyone here to participate and tell us what you think about the session today. So if you can quickly jump on that chat and click on the link, it will come up. And I'll also share the screen here because you can as well just use the QR code and do the same thing. So it just takes you to a survey that you can complete, just 9 questions, which is very quick. And that would come back to us and we're able to look at how we did today and other things that we've done across time. Now, for me, feedback is important. It's important because we want to know what we can do better. You know, there is no perfection in the things that we want to do. And nobody ever does gets to perfection, but we want to improve ourselves each time. And in doing that, we do want to commend some of our members who have taken the lead to go beyond just the borders of what African chapter does to improve on what the Academy is offering. These individuals has played significant role in our achievements today. Without these persons on this platform, there might be difficulties in getting through all our case reports. In fact, I remember specifically Obi-Wan taking it on him to make sure that the case reports were returned on time from one particular committee, going aboard to talk to the academy to say, look, we are Africans are waiting for this. We want this to be released so people can prepare for their visas. You know, I think having those voices really helps us, because they don't understand that our challenges are very unique to Africa. You know, when you're looking for a visa date, you want to make sure that you're traveling, want to make sure that you're going to present your poster, all those things happen. And I think with that, we really want to see that we get our voices heard in some of these committees. So thanks to everybody here who have played a role somewhere or the other to promote the African initiative. And I do commend Obi-Wan strongly because of his role as the admittance chair as well, which really is helping us to get our candidates through. Now, for other ones too, there's opportunity to serve in different domains of the academy, different committees, special interest groups. Please do volunteer. You know, it doesn't take so long. It doesn't take so much of your time. Meetings could be once a month, sometimes once in 3 months, but please do make time to be there because it does help us to see that we can represent Africa more effectively than we are just currently doing. Now, just in recognition of this, I want to see if we can just have a minute of silence because right from the start of this year's mentorship program, I had a member who rang me and lost the son. The son, they live in the UK, the son took his own life and he dropped out of this fellowship program because of that. I do have members who lost their husbands. I have members who lost their mom, their dad. We have members who have lost very close friends, and that has impacted on their progress today. And not because some people are making it today to go to the academy, it's not because they were more more prepared than others, but there are people who had this misfortune, came on them, and those took significant hit on their progress. So if you can allow me just a minute of silence, please, just to recognize all members who have suffered one loss or the other that may have impacted their progress or their involvement in this group. Yeah, may the soul of the departed rest in peace. Amen. Yeah, thank you, everybody. And we do pay our condolences to all those members as well, some of who are on this platform today. So continuing that, just special thanks to Covin and Professor Tuani for breaking down the specs 2030 to what it means to an optometrist in Africa. And I also want to recognize those who conducted a mock examination. That was a very tough one for us because it took a lot of time reading out the case reports, coming out with the questions. There was a lot of organization that was involved. And that's why we couldn't run a second one, because it really took a lot of energy and time for those who did it. So Damian Echendo was the chair of that initiative and really took it on board, bringing people like Professor De Gaulle in, Marike, Bernardine, and they all sat different times, met different times to make sure that this was really done properly. So thank you all for that time invested in doing that. We also want to pay respect to every member of our platform in the WhatsApp group. The show of respect, the professionalism, your dedication and interaction is really changed the game for me. It really tells me that we can do much greater than people think as well. Because I see a lot of connection, network building, strong advocation for optometry. Really, this is really very encouraging to us. And thank you for conducting yourself in that special manner and that professional manner as well. Now, for those who have shared information in the chat, volunteer their time to take people on the guided journeys through the program. Some actually started coaching others on how to get involved, becoming fellows. Some provided information on how to travel, get travel grants. That was really encouraging to see how we support each other to build that capacity. I do thank you all for that contribution as well. Now, it's also time to celebrate at Indy. For all these years and things we've built together, there'll be new fellows that will be crowned as fellows in the academy at Indy 2024. I do plead with you to make time to find where they are, give them a hug, congratulate them, take a photo with them, because it's really a joyous moment, This before now it was a tough journey for any African to get there. The cost involved, the travel plans, the grants weren't coming to us like they are now. So there's a lot of initiative that has really been brought on board for Africa that we really need to celebrate. So make time to catch up with them when you're there, if you're going to Indy. Some of us will be presenting posters, papers, attend the posters. They're all on the app. Search for anybody's name. You see it there. Make sure you attend and see them, have a photo, talk to them, interact with them, so they can feel like something's happening. Sometimes you're standing there and nobody's talking to you. It's really an awkward moment. But if somebody comes around to cheer you up, it does bring your spirit high, make you feel like you're doing something really that people appreciate. So please do make our time to be there. Award recipients as well will be receiving the awards at the academy. We also need to be there to congratulate them and support them and give them the encouragement that they need, and that will make them feel really special at the academy. So we are still having few challenges as a chapter. There are things we want to achieve which we haven't been able to. One of which was the part that South Africans, we are not included as a country that will get the sort of discounts and benefit that other countries like Nigeria and Ghana do get. It led to us having 3 South Africans drop out of the fellowship process because they couldn't pay for it in the way that we had subsidized it for other ones. We are really advocating for that because, this classification was based in previous times. Things have changed now. We do think there's individuals who cannot still afford it, but they live in South Africa. So we are taking that on board and want to make sure that these things they can listen to us when we go this time at Indy in some of our meetings as well. There's continued advocacy for Africa through the subsidization of different programs. Recently, we got them to listen to us and reduce the The Flown Leadership Program, the cost was reduced for one of our candidates who wanted to be part of it. Because I calculated that for an optometrist to be part of that program, you have to save for 4 months if you're working in Nigeria. And I was asking them, how many of you will save your salaries for 4 months just to go to a leadership course that you can't use in your practice? It's just for you to lead a team to be, and I mean, this is really, it boils down to that. And if you look at it, it's not an easy process for someone to go to the journey of being a fellow. Then getting into all those special interest groups, they all also require money. So I want to see how we can push forward as well to get that reduction and subsidization happening in other spaces. So when you're becoming a fellow, you still be encouraged to do other things while in that category. So there's also funding that we are looking at, like we talked about the dues things. We'll come back to that maybe next year to see what our survey tells us. So in that survey, there'll be questions around this too, which we do expect everyone to respond to. And the survey is unanimous, so we don't know who you are, we don't want to, so we can have an unbiased view and be able to analyze that properly. Now, the last thing here, just before I end, is the difficulty in including non-English speaking African countries. We had difficulties in bringing people on board where this meeting is basically in English. You can imagine if somebody is coming from a Francophone country, they actually will not want to be here, because we are not including them. We're not thinking about them. So we want to start looking at ways that we can bring them on board, because that's what optometry is about. It's an African thing. We want people to be included irrespective of their language or where they are. So people living in Mozambique who want to be here and get somebody speak to them in a language that they will understand so they can participate. So those are the areas we want to see improvement. We are trying to expand our horizon as well. And we do ask for any contribution or any lead that you have in that space. Please do let us know. And I think with that, I will end my talk today. I just want to say a big thank you to everyone here. Everybody here has been very special to us. People attended meetings, hosted conferences, chaired several webinars, just calling on them and they say, yes, Levi, we're good to go. We can support in this space. It really encourages us to move forward. So thank you, everyone. I off my heart for you guys, man. Thank you.
Thank you so much, Dr. Levy, for those closing remarks. And yeah, to still carry on about the issue of the Francophone and the Arabic-speaking countries. It's one of the initiatives that we've taken up from the African Council of Optometry Education Committee. We're trying to see if we could carry some research and run a survey to identify the actual needs, because it's one of the things that we've noticed has been hindering their participation in AFCO, now the academy, and the questions I keep asking now is, when will you start including us in everything? Because it feels like we're saying Africa is only for the English-speaking countries, and that we have the Francophone and all the other nations that we have to put into consideration. So we're trying to work on that as well. And hopefully over the next few weeks and months, we shall have something out and we shall be able to identify the needs and the challenges. So thank you so much, everyone, for all the dedication, the commitment, and everything. I'm just going to give 1 minute for just in case anyone has anything that they would have loved us to share before we proceed. Yeah, in case anyone has anything else. And then please just go ahead and respond to the survey. Follow the link that has been posted, and we shall go ahead and hopefully we shall have the results in the next meeting, right? We can't display it in this particular session here. So please feel free to participate in that survey, and we might have to carry the same link and post it on the WhatsApp group as well as a follow-up, or just in case anyone might have had difficulty accessing it while they're on this particular Zoom platform. So anything that anyone would have loved to let us know before we go into the closing prayer. And we shall also use that time for anyone who would like to lead us through the opening prayer from the Islamic faith or from any other religion other than Christianity. Please just prepare yourself in the next 1 minute. Okay, and I think silence would mean we don't have any other business to discuss. So I would like to call upon anyone from any other faith who would like to take us through the closing prayer for this session before we call it a day. For others, we call it a night. For others, we call it the start of a brand new week. So anyone who would like to take us through the closing prayer? from a different religion.
Okay, shall we pray?
Yes, please.
Heavenly Father, thank you for this wonderful AGM. Thank you for the African chapter. Thank you for the momentum, the acceleration, the vision, our leadership. Thank you, Father. We are grateful for this, and we believe that greater things are yet to come. In Jesus' mighty name, amen.
Amen. So thank you so much, everyone. We appreciate all the time. We apologize for the 15 minutes that we've run over time. But yeah, we really hope you all got the best out of this meeting. And we look very much forward to seeing you at the next one. I remain Wanok. The other name is Godfrey, that everyone here would know that I rarely use. But yeah, thank you so much. I'll see you at the next one. And for those who are going to Indianapolis, we wish you all the very best. And yeah, we shall keep you updated on all the other various platforms. Thank you so much.
Bye, everyone.
Yeah, thanks, Wano. That was awesome.
Yeah.